I'm from Chester, Montana.
And I am from Winifred, Montana. Winifred is about 150 miles away from Great Falls. We both went to school at Montana State University in Bozeman and met there toward the end of our college careers, and basically been together ever since. I think both of us were agreed on that right away. We both wanted to be parents. We came from pretty big families, so.
We tried for a year, and then I think it was my biggest fear, so not to get pregnant, so right away I was like, okay Mom, like we've been trying for a year, what do we do? So it was about a year, and then we got in to see Kelly Timmer. So Kelly diagnosed me with PCOS, which is polycystic ovarian syndrome, so that was the main reasoning for infertility. It's really hard. I don't know, I feel like emotionally and physically it was really hard for me.
Yeah, going through 10 IUIs is very physically and emotionally draining.
We found out we were pregnant, and then she actually got to do the first ultrasound, which was really cool. She's like, yep, there's two. And then she kind of stopped talking, and we were both like, what's wrong? She's like, actually there's three. And I think we were expecting there to be two since we implanted two. But the fact that there were three, I think a lot of people would be like super nervous and scared, and not that we weren't or surprised, but we just feel so blessed that we were able to have 3 babies instead of 2. So their names are Traylon David and Trexton Doyle. We decided that we wanted to use T names, Timmer, Duke, and we both discussed Timmer for a really long time. I suggested it to Dillon, and Kelly Timmer just had such an impact on our life. So the pregnancy was considered high risk because obviously there were multiples, so there's more than one baby, but since one of those eggs had split, there's identical twins, and so they're in the same sac, and so they worry about twin-to-twin transfusion. So Dr. Murphy was really, really great. Dr. Murphy's role in the care was just to oversee all the ultrasounds and come in and make sure all the babies were growing properly and making sure that there was no signs of twin-to-twin transfusion, along with making sure that, we were on track as far as a triplet pregnancy goes.
To get the level of care we got at Benefis, I would say means the world to us.
It's kind of indescribable. I feel like, we, from infertility all the way to having children to the care our children have gotten, and we didn't have to go anywhere else, is amazing.
So for the delivery, they had a scheduled C-section for August 27th, and Lexi made it right up to that day, and that was the day they were ready to come out, so it worked out perfectly. And the amount of time and effort that the team at Benefis took to prepare for her delivery was incredible to me. Everything, from the NICU being ready 2 months before we were scheduled to have the triplets, to the delivery room being set up with 18 other people in there with us.
Yeah, so I felt like I got to have a really good conversation with Dr. Palin, and he is very calm and relaxed, and I could ask him anything, and he explained from start to finish how he would do the procedure and the C-section and how fast each baby would come out that he predicted, and so that for me was really comforting, that I knew exactly what he was going to be doing since I wasn't going to watch him.
So 18 people sounds like it must have been chaotic, but like I said, it was very well thought out and prepared, and the NICU staff did a great job. They got all 3 boys out in 3 minutes, and so once each team got their assigned boy, they got them all ready to go down to the NICU, and they took them down one at a time, and I got to go down with the last one. So I've been driving a little bit back and forth just to go and help out with work. Lexi has been here since July 9th, staying in the Gift of Life housing, which is a remarkable opportunity that Benefis offers to people. It was just like kind of our home away from home after a while.
Yeah.
I would say for us, the facilities at Benefis was very convenient. Like I said, over a span of 2 years, we only went to one building until right up to the delivery. The care we got at Benefis, pretty remarkable in terms of we came here over a span of 2 years. And like I said, the least amount we were here was 3 times a month. Most of the time it was a lot more than that. And we never had a single complaint about staff or nurses, doctors, anyone, a receptionist, anyone. So to get that kind of care over a span of 2 years in a difficult situation for us, and so I would say that says a lot about what Benefis can do for people.
Just the fact that like at night when you leave there, they're getting 24-hour care, and you know that if an alarm goes off, someone's going to be there for them, and that's really comforting for me because you're leaving your children in someone else's hands.